All right, I'm going to get us started. Hello, everyone. My name is Jordan Hines, and I'm the Program Director for the Children and Families team here at the National Governors Association Center for Best Practices. The NGA Center is proud to welcome you to the 2021 Child and Family Wellbeing Governors Summit. This convening is the culmination of a learning community organized by NGA and generously sponsored by Casey Family Programs. Over the course of the past 9 months, the Child and Family Wellbeing Learning Cohort has fostered a collaborative peer-to-peer learning environment for states to learn together, share best practices, and advance initiatives that promote child and family well-being in their states. Gathering monthly, this learning cohort has convened a network of peers from across and within the states, including from Arkansas, Connecticut, Delaware, Hawaii, Iowa, Kansas, New York, Virginia, and West Virginia. Today, you'll hear from 6 of these states about strategic initiatives they've developed as part of this network through technical assistance with NGA and Casey Family Programs. Following these presentations, we're thrilled to host a panel of governor's advisors, which will impart wisdom and insights into governor's priorities in this important field. And now a quick word on webinar logistics. If you would like to ask a question of the panelists during the panelist section or of the state presentations, please submit it in either the Q&A box or the chat box at the bottom of your screen. We will try and answer it in real time, and we'll send out a follow-up email with responses as well as contact information for state and relevant resources. So now I am happy to present some remarks from David Sanders, the Executive Vice President of Casey Family Programs, who has generously supported this learning network as a partner and supporter of NGA's Children and Families team.
Hello, I'm David Sanders, and I'm a Vice President at Casey Family Programs. And I would like to thank the National Governors Association and the 6 states who are participating for your leadership in caring for your most vulnerable citizens. You've done that through your involvement in the Child and Family Wellbeing Learning Cohort. The most important job of government is protection of its citizens. And the most vulnerable of those citizens are children who are abused or neglected. What's most important is to get to them before they are abused or neglected. Too often, as a system, we respond after children have been harmed and are able to provide treatment, but the devastating impact of abuse or neglect has already occurred. Those of you participating in the cohort are saying that you are committed to creating conditions in your state that assure that many fewer children ever experience abuse or neglect. I believe all of you in attendance have made that commitment. Connecticut, Delaware, Hawaii, Kansas, Virginia, and West Virginia have all chosen issues that suggest that you are well informed and serious about improving the condition of children in your state. It's clearly tough work, but with your attention and continued prioritization of these issues, I believe that you'll produce positive results. It's important for me to reiterate that at Casey Family Programs, we're committed to ongoing support for all of the states that are engaged in efforts to improve conditions of the children and families in your state and in your communities. And I'd like to assure that will continue that commitment after this cohort. In addition, I do want to, again, thank National Governors Association for their long-standing partnership with us and their commitment to leadership in assuring that government is able to carry out its full responsibility. So thank you, and have a successful meeting.
And I would also now like to introduce Ryan Martin, who is the Deputy Director for the NGA Center for Best Practices, where he leads the center's policy work to help develop innovative state solutions. Turning over to you, Ryan.
Thanks, Jordan. Great to be with you all. It's great to see a short note there from David Sanders. I've known him for a decade. Great person and a great partner to NGA as well in supporting the work that we do with states. Really glad that we can have so many folks joining us today. Looking forward to coming months and years when we'll be able to get together in person again and have these kinds of discussions, which will be great. I just wanted to give folks a real high-level overview of NGA and the Center for Best Practices, and just really congratulate the states that have participated so far and talk about some of the things that we can do to help other states as well. So the NGA Center for Best Practices consists of 12 different policy teams. And if you look at our website and you go to the staff list, you can see under program director, you'll see Jordan listed there as the program director over children and families, and then the other 11 as well, covering a variety of areas, everything from energy, infrastructure, broadband, healthcare, public safety. And so it's really great to work with states and to help them move their policy goals forward. Each team is fairly small but mighty, as few as 2 and as many as 5 or 6 staff. And our role, there's a few main roles that we fill as NGA. One is as a convener. I'm sure many of you have seen, obviously, through this webinar and in-person meetings that we're all about getting people together to share ideas, pros, cons, things they've learned, trials they've been through, challenges they faced. And so we're glad that we can do that again today. We're also facilitators, helping exchange information. We get lots of requests where a state may be in a certain situation and they say, we're trying to figure out this certain issue. Can you help us out? And so our role isn't necessarily to always be the expert and know the information, but it's about knowing the experts and how to find the states and others who can help you achieve your goals. The other is a great visualization a former colleague mentioned to me is calling NGA as a personal trainer. So this is the kind of, what do you want to look like next summer when you go on vacation? It's this idea that we work with states to help them distill their goals and their plans and to come up with actionable policy information so that they can not just think about policy, but actually apply it in the state. The states that have participated in this cohort for the last 6 months have really focused on improving service delivery and better coordinating with other systems. And that's a really key role that NGA can help play. There's lots of organizations that work in specific health issues or children's issues or education issues, but our key role at the National Government Association is that we can help states link work across silos. Governors are able to direct the focus of multiple agencies and even non-governmental entities to really coordinate in a way that individuals in the state or other organizations may not be able to. So really grateful to Jordan and her team who've done a great job in working with states and providing you the information you need. And I'll turn it back over to Jordan.
Thank you so much, Ryan. I am now so excited to present to you the 2021 Child and Family Wellbeing State presentations. These presentations are recorded, but we encourage folks to engage in the chat and connect with peers in real time during presentations. Unfortunately, we are running on a tight timeline, and in order to fit everything in, we don't have the capabilities for a live verbal Q&A, but if you have questions about a state's presentation or landscape, please drop it in the chat. And a state team's representative can answer in real time, and NGA will certainly also coordinate responses and follow up on any questions following the summit. And with that, we can kick off the presentations.